Hi everyone, welcome to my channel, and today we are going to learn about basics of EKG. So this is the basic structure of EKG. So this EKG represents the electrical activity in our heart. So we are going to just name it right here. So this is our P wave right here. This is our Q wave. This is our R. This is our S, and this is our T wave. So these all waves represents electrical activity in the heart. So this P wave will represent the depolarization of the atria. Depolarization of the atria. This QRS will represent the depolarization of ventricle, and this T wave will represent the repolarization of ventricle. Sometimes you're gonna see the U wave around here, and that we are gonna see at the end of the video. So let's just jump into how to read the ECG. This is the basic information that you have to know in order to understand the ECG. So first, when we look at the ECG, we have to identify that this ECG is taken right or not. Because sometimes you put the lead in the wrong location and it will give you the wrong ECG and it will give you wrong information about the patient. So you have to understand that this ECG is right or not. So in order to understand if ECG is right or not, you have to look at AVR lead. AVR lead. You already know that there is 12 leads in ECG. In that, we have to look at the AVR lead. It should be negative. AVR lead always should be negative, and this represents that this ECG is taken right. If you want to understand how this AVR lead will be negative, you have to understand this. So let me just draw the heart. We will draw the basic shape of the heart. This is the apex of the heart. And you already know that apex is on the left side. So this will be right side. So this is AVR. So this is AVL and this is AVF on the feet. There is V1 to V6 will be around the heart, like V1, V2, 3, 4, 5 and 6. And 1, 2 and 3 lead. Okay? Sorry. 1, 2 and 3 lead. So this is the 12 lead ECG. In this, you know that our electrical impulses generate from the SA node and it will go to the AV node and then it will travel like this. So it is traveling opposite to AVR lead. That's why AVR will always be negative. How our AVR lead will going to be negative. So now we are going to understand how you will calculate the heart rate. So I'm going to draw the simple ECG here. So this is our P wave, this is our Q, R, S, and this is T, P, then our Q, R, S, T, T. Okay. So this is our basic looking ECG. Now we are going to draw the small boxes that you can see in the EKG, actual EKG. So this is our first box, this is our second box, this is third, fourth, fifth and go on. So I'm gonna just tell you the hint that this is a tachycardia. How you can identify? So you just have to look at these big boxes. You have to start from this R wave. R wave to R wave. You have to calculate from R wave to R wave. So you will calculate heart rate from R to R wave. You have to calculate from the large boxes, not from the small boxes inside the large boxes. You have to just know the large boxes. You will start from here. This is 300. So 300, okay. Then you have to divide it by the number of boxes. Then this is 2 boxes. Then 300 divided by 2 is 150. 300 divided by 1 is 300, okay. Then 300 divided by 2 is 150. Then 300 divided by 3 is 100. 300 divided by 4, which is 75. 300 divided by 5, which is 60. So if this R wave is from here to here, then it is 60 heart rate. From here to here, then it is around 75 heart rate. Then if it is from here to here, then it is around 100 heart rate. So this is around 150 heart rate. That means this is tachycardia. So this is how you will calculate the heart rate. So next step we are going to move on to the axis. How you will know that this is right axis deviation or left axis deviation. So in order to understand the axis, you have to remember this graph in your mind. Okay, we are not going to draw it in your exam, you just have to remember in your mind. So this starting with 0 degree, 0 degree, from here you will go plus 90 degree, plus 180 degree, and minus 90 degree. Okay, so this will also be your minus. If you don't want to remember numbers, just remember this minus, it will be easier for you. So plus will be here, both plus will be here, and both minus will be here. And our normal axis is from minus 30 degree to plus 90 degree. So it will be here, it will be here. So this is our normal axis. Between this, there is no axis deviation. Beyond this point, it is left axis deviation. Beyond this point, this is right axis deviation. In order to understand the axis, you will look at only two ECG leads, which are 1 and AVF. You will represent one lead here. This horizontal is one lead and this vertical is AVF lead. Okay, so you have to just put the dots here and you will know that this is which axis deviation. So moving forward, left axis deviation will represent left bundle branch block, and right axis deviation will represent right bundle branch block, and it also represents the right ventricular hypertrophy. So this is how you will determine the axis deviation. Now there is a quick method to identify the axis deviation, and you will not require to do all of this. I'm going to show you how. So you just have to look lead 1 and lead 2. Okay, these only two lead will tell you a lot of things. So first you will look at AVR. AVR should be in the negative side. Then you will move forward and look at these two leads, lead 1 and lead 2. If both lead are positive, then it is normal axis. If both lead are positive, then it is normal axis. If lead number 2 is negative, then it is left axis deviation. If lead 2 is negative, then it is left axis deviation. If lead 1 is negative, then it is right axis deviation. If lead 1 is negative, then it is right axis deviation. So simple. So let me go through again. First you will look at AVR. You will know that this ECG is taken right or not. AVR should be negative. If 1 and 2 both are positive, then it is normal. If lead 2 is negative, then it is left axis deviation, and if lead 1 is negative, then it is right axis deviation. Simple. Now we will move forward and we will see PR interval. So this is our basic looking EKG. This is P wave, Q, R, S and T. Okay. So this is P, Q, R, S and T. Now to identify the PR interval, we will see from this to this to here. This is our PR interval. This is our PR interval. Normal PR range is 120 to 200 millisecond. So normal range is 120 to 200 millisecond. So this PR interval can be more than this or can be less than this. If PR interval is prolonged, then we can say there is first degree heart block. If PR interval is shortened, then we can say WPW syndrome. So WPW is just the example of short PR interval. There will be lots of other example of short PR interval too. And one of the example of prolonged PR interval is first degree heart block. So moving forward to another is our QRS interval. This is our QRS interval. This is our QRS interval. So normal range of QRS interval is less than 120 millisecond. If you have know that we have big box and inside it we have little firebox. Okay, so this little box represent 40 millisecond, and this whole box will represent 4 into 5. It means it will represent 200 millisecond. So this QRF should be less than 3 boxes, should be less than. small three boxes. Okay. So moving forward to another, which is QT interval. So this is our QT interval from here to here. So obviously if QRS will prolong, QT will also prolong. But if QRS is normal but QT is prolonged, then there will be abnormality around here. Okay. So this is our repolarization phase. So there will be abnormality in the repolarization. And the main culprit in the repolarization is our calcium. If this period is shortened, then there will be hypercalcemia. If this period is shortened, then there will be hypercalcemia. And if this period is prolonged, then there will be hypocalcemia. Okay? And another causes of prolonged QT interval are drugs and long QT syndrome. Congenital long QT syndrome. There is one feared outcome of prolonged QT interval is torsade points. And this is most feared outcome. Why it is most feared outcome? Because if you will see the ECG, you will yourself will get scared that you will see the ECG looking like this. Okay, so this is the typical ECG of torsade points. So let me compare it with QRS wave. So this is our P wave, this is our QRS, and this is our T wave. So this is not normal looking T wave. This is peaked T wave, and this you can see in hyperkalemia. When you have high potassium level in your body, you can have the peaked T wave. And what other thing this peaked T wave will represent? This will represent hyperacute ischemia in your heart. That ischemia is going on in your heart right now. So moving forward to another wave, which is the last wave that you cannot see in here, but sometimes you will see another wave looking like T wave, which is our U wave. Like I have told you in the beginning of the video that you can sometimes see U wave. So when you can see the U wave, when you have low potassium level, when you have hypokalemia, then you will see the U wave. Okay, and what this will represent? So sometimes it will represent the repolarization. Okay, repolarization in Purkinje fibers. So thank you for watching this video until now, and if you like this video, then hit the like button and subscribe to the channel and share it with your all friends who needs to learn the ECG.